that great interaction. We'd like to invite now the examiners that are here. Professor Abdul.
Okay. Thank you very much, for your presentation and for your interaction. I also want to add my voice to congratulate you that someone who was working as an interpreter at the beginning of his PhD, you defended, the defense is excellent. Congratulations. A lot of the questions that I'd like to ask you, I think have been asked, but the other thing I'd like to congratulate you on is doing a purely qualitative thesis in this college. How did you justify it? Maybe that's my first question. How did you justify using a purely qualitative research methodology?
To be honest, I'm a quantitative person working on health finance, and my mind was more open on quantitative data analysis than qualitative analysis. So when I started this program, my first interaction with Ugandan team was a shock for me, because finding an evidence for me was like what it is, because that was my first time to go through a database to download an evidence. Because for me it's like I have my numbers, I know I have software, then I do the analysis and I publish the reports. So but now when I started to discuss with the team here, to interact with professors, especially after the comprehensive courses that we took at McMaster University in Canada, it started to change my mind, and then I started to realize that it's not only the qualitative data that we can do, but there is also another domain that need to be clearly understood. So this is how I started the process, and I can say it was useful for me, because right now it's much more easy for me to discuss about qualitative work than quantitative. And even when I do quantitative data analysis, at the end, the way I analyze the data, is through different framework, instead of using my software template to do the analysis.
Okay, thank you. So the limitations that you present to your study limitations, that you list as some of your study limitations, is that the cases, you had limited cases. So my question to you is this a strength, or is it really a limitation, given that you're coming at it from a qualitative research angle?
To me, it might be a limitation, because I wanted to learn more, because I believe some of the results that I presented here, if I had an opportunity to study different units, I might have learned a bit more and having more data to show here. So probably the way I framed it as a limitation might not be 100% correct, but the aim was to see whether understanding other units that have collapsed might have provided different perspective, because of especially that non-communicable disease unit might have been a limitation, because if you come here in Uganda, you will see that those units they are all in the same level of difficulties. So probably someone will say, okay, what you discover in Burkina might not be a unique case, because it happened to many different units. So that's why I was looking for something that really collapsed, and many people don't even hear someone talking about that unit in the system. But when you look at the framework, the unit is still in the Ministry of Health organization chart, and also they are still getting state land budget. But why there is no activity carried out in the system for that specific unit? So maybe we could have built more, try to find additional limitation to sustain the case that we've raised in this paper.
Okay, so you feel that the evidence that the data you got from that single case is insufficient?
For this perspective, probably yes, but we thought additional information could have came through other unit that's if we had an opportunity to study it.
Okay. The other limitation list is the limited number of interviews that you did. And I was trying to understand that as a limitation. In qualitative research, having a limited number, compared to quantitative, it's always a limited number. And one of the reasons is that the individuals that you select with a purpose. And I heard you say yourself in that particular unit, you couldn't have selected any more because you interviewed everybody who was in that unit. So I was wondering, why would that be a limitation? You interviewed everybody.
Okay, like if we look at the creation of the two first units, for example, I look at some of the meetings minutes. So you will see many different people who were part of the discussion. But in reality, most of them could not provide relevant information on how they ran and the discussion was led to come up with the unit's implementation. And because it was a long process, because some people were part of the discussion, sometimes they are out, and recalling all of them was difficult, although we know that some of them play a key roles in a way that like government donors, for example. Donors are the key players, and some of them were part of the discussion. And we knew that they are the one who provided the ideas. They are the one who provided the fund and who pushed the government to create the unit, for example. But they did not want to talk about it. And so that's why we said having them could have, improved the data. But and we are expecting additional study to be able to convince them to talk about this kind of issue.
Don't you think that they're refusing to talk was in itself data?
I don't know.
Yeah, but when you ask me to say something and I was present and I don't say anything, doesn't that tell you something about me? I think it's something for you to think about, because we look at both the implicit and the explicit. You can talk, but by refusing to talk, why? You ask yourself the question, why? Why would this person not speak?
Okay.
My final question, actually, is about your first paper, and you analyzed, you looked at politics, you looked at politics, problems, and policies. And I just wanted to follow up very briefly about the influence of development partners. Somehow in that framework, they don't appear to be part of the politics. Or did I miss it?
No.
They're not?
They are hidden participants in the process. Yeah, so you don't see them officially playing a key role, but they are the one pushing the ideas, and they are the one providing money to the government workers to meet. So if they are not even convinced to the idea, they will never provide the money for that. So, but you don't see at some level you don't see them, or if you see them, it will just be their representative who will talk on the behalf of the other donors. So, and it's just sometimes a paper that they usually take time to write everything, write it down, so that they will make sure that someone will not say something that is not an agreement among all of the donors, and then they submit the paper to the government, or sometimes to someone within the government team to read it. They will not read it.
And I feel that that's one of the strengths of doing qualitative research, is that they capture the hidden and what people would not otherwise say. So I felt that when I saw the framework and I saw they were not, the way it's very clearly demarcated, they just do not appear part of the politics, and yet that's where the new politics is something that I think you can think about in the future. So thank you very much.
Thank you very much, Professor Anne. I will invite Professor Joan Alango.
Thank you very much, Andre, for this interesting work. I was very interested in to hear about your growth as a PhD student, and I think I've picked a bit from what you have been saying, but maybe is there anything you have not said with regards to your growth as a PhD student?
I don't think so. I don't think so. Probably the language might be something that I would be working on to improve, because these papers was a lot of stress because of I have to start everything ahead and make sure that I get support from the supervisors, because they need to read it carefully and make sure that, you know, sometimes I'm just writing my French ideas, and that might not be in line with when it is an English idea. So they have to make sure that everything is correct, and and I think that's why we were meeting sometime to make sure that everything is correct. So
do you think from the information you've given as as you are writing your thesis about yourself and what you have presented in relation to what you have done, do you think you have done justice to yourself and to the work?
At the beginning of the process, you just think about getting a degree. But then, when you see people interacting with you about what you've published, then for you now, you're starting to see that this is something important, because that's why people are, sending you email to understand about it, and trying to use your work to support other discussion. So now I feel a bit confident that I've done something that could be important for some users, and starting to see people when they are talking about knowledge translation, saying my name. So probably I've contributed to something, and I have to keep myself inside the process and keep learning from the supervisors and the professors and other teams, so that I could still improve myself in this work, because I did it, but it's not something really easy.
Okay. I felt when you started to talk about yourself, where you came from, I felt you had not done justice to the description of this, because you said you've been mostly a quantitative person, and you were doing purely qualitative work. And from your qualifications, everywhere where I looked, I was just in MSc and nothing else about you. So it's not easy to understand who you are, and that's very important for this work. So as you could do something, give some more information about who you are and maybe where you stand already at the time you begin this work, so it will help us to appreciate. So going from that, looking at your work, mostly I saw a focus on issues in Burkina Faso, mostly. And I wonder, did you, as you were thinking about the whole project, did you think about the global issues on policy making and what are the issues out there, what are the processes out there? Can you just highlight something about that? Because mostly what I see here is Burkina Faso.
Yeah, I think if we look at right now some of the global policy key important thing regarding the universal health coverage, for example, I want to use it as an example. I was leading the universal health coverage process in Cameroon and Benin, and this work was something really important to support the universal health coverage process in these two countries, especially regarding the benefit package configuration in the system. I remember in Cameroon, for example, we had in the meeting room something like 50 professors from different health system domain with different specialists. Then we have to talk together to come up with a benefit package. And someone in the room taking care of a specific disease, for him his disease is the most important thing in the health system. So it has to be in part of the benefit package. So I have to use my like the policy dialogue that we used to conduct through this work to help them and make sure that although we have some specialists in the room, we don't have to take all those diseases in the benefit package, because it has to be a public based on the frequency of the diseases in the system and how much it's expensive, and also the add value for the health system. So those are the skills that I've used from this study, the courses that I did, and all those stuff, and then to support and build different things in the somewhere else, and not directly in this particular work. For example, in Benin, no, not in Benin, but in Haiti, for example, where I used to work a lot, we had the same discussion about benefit package, about health information, about some of the diseases implementation in the health system. So using the skill, like to help them and narrow down some of the discussion and make sure that we are not just building something according to what the health system might be looking for, but we are also looking at the global leading process regarding some specific key issue, regarding health finance, regarding benefit universal health coverage and implementation.
So looking at how you presented your work, you had 3 sub-studies, and you more or less presented them as 3, separate. So what is that one story you want to tell us from your work?
Okay. What I would like to say about especially looking at the link about from the 3 studies. The main purpose of the thesis was to support the rapid response unit institutionalization. So, but before we do that, we have to understand, because the rapid response service is a unit that we would like to introduce something new that we would like to introduce in the health system. So, as a story is that, what is the process to introduce a new unit in the health system? Do we just come and because we have donors fund and then implement something somewhere in the health system? So we didn't do that. We started to look at the government practice in introducing a unit in the health system, And that's how we discovered that you need to get a decree, you need to get an approval from high-level policymakers, and you need to get their support first before you introduce the unit in the health system. That's the first part of the story. The second part of the story is that why some units that have been introduced by donors have survived in the health system, and while some of them did not survive. And then we have to connect that second study with the first one. We introduced a unit in the health system, but we would like that unit to survive. So what are the key factors that usually sustain unit institutionalization in the system? So having learned from how to create and introduce a new policy unit in the health system, and also having learned the key factors that might lead to the unit in the health system institutionalization, and then combining them, we can now say, if we want to introduce the rapid response units, institutionalize the rapid response units in the health system, then we have to pay attention on some key components. Because at the time we introduce the rapid response unit, we might not talking about that unit's full institutionalization, but a step forward to the unit institutionalization in the health system. So some of the key components that we've learned could be important to sustain the process in the health system.
Okay, but I see you focusing mostly on the rapid response system, and I'm just wondering, so does this mean that we can't borrow information to introduce something else?
We can use, I think this is one of the questions that Professor Ruth asked about introducing the same process outside the health system. So I think step that we've used to understand the policy making process could also apply to different units instead of the rapid response unit itself. And I think one of our suggestions was that anytime we would like to introduce a new unit in the health system, we might try to learn from existing units and make sure that some of the steps that we've used to introduce other unit could have been also used for the new unit that we would like to introduce.
Okay, thank you. So I saw as one of the criteria you used to select the units that you studied was having existing legal text. Is that correct?
Yes.
Do you think there's a limitation with that, or?
I will not say limitation, but the legal text is that because we would like to make sure that when we are talking about a unit creation, it's something that someone will say it's not just a small project that someone piloted in the health system. So that's why we want to see a document that is showing that this unit is part of the health system. It has been a policy that has been discussed, and there is a signature somewhere saying that this is a government unit, just because we would like something sustainable to talk about. Because there is a different project that are in the system, but there is no official documentation about it. So if I have used those units to discuss, probably someone will say, this is not sustainable because yet we are not recognizing this unit in the system.
But looking at, I don't know where you've read around, aren't there units that could be set up without that kind of important documentation? Because if you select such a unit, then it's already a unit which is somewhere on the way to doing the right thing. So is it possible that there are units which are really government units, but there's no documentation to their setting up, and does it have an influence on whether they survive or not survive? or how the process moves?
I don't think there is a government unit that is in the system without a particular official documentation to introduce it. They might start from pilot phase without an official documentation, but as soon as this unit is part of the Ministry of Health organization chart, it means that somewhere there is an approval. There is an approval. And we wanted to build our case based on something that is official. For example, if we look at the program for non-communicable disease, if this unit was not something with an official documentation that lead to introduce the unit in the system, someone would have said, okay, you've choose this unit, but it's not part of our system. We don't even recognize it because there is no official documentation. Especially some NGOs sometimes introduce process in the system without official approval from the government.
Okay, I think something to reflect on, because especially if you say that the process can start without, the official documentation, because that means that if you have the documentation, you're already on the right track. So it has an impact on, whether people will follow through what has already been written and all that. So it's something to reflect on, whether it does not change the results in terms of your institution, whatever that one. But okay, so looking at this work was purely qualitative, so I would have been very happy when you're doing what you're calling limitations, to hear this strong qualitative language. So can you tell us about the trustworthiness of your work?
Could you please reframe it in a different way, because I'm not really picking the question?
What I'm saying is that you did qualitative work, and so there's language that, whereas when we are dealing with quantitative, we are mostly talking about methodological issues, limitations really. When we are having qualitative work, there's language that is used, and there are different aspects of that which you evaluate to look at what we call trustworthiness. So that's what...
Yes. I think one of the key components of the language in especially this work as a qualitative study is the framework. I would say use a framework to guide the analysis might be one of the key words that I would probably highlight here, because to be honest, when I'm doing quantitative work, especially in the health finance domain, we're using mainly softwares template to do the analysis, which is different when we are doing a qualitative data analysis. And then even the data collection process has to follow the framework that you want to use for the data analysis. So the framework itself will guide the way you would like to conduct the interview. And I remember the supervisor asking me to reorganize the question that I'm planning to ask during the interview according to the framework that I'm planning to use, so that during the data analysis, it's going to be easy for me to use like a word table to organize everything. So yes, the word that I would highlight here is the framework.
So
I don't know if I'm answering the question.
Because when we're doing the quantitative, you're talking about internal validity and all that. So I wanted to hear you talk about credibility, you talk about objectivity, transferability, and all those aspects in relation to your work.
Okay. probably I did not use most of these keywords in my work. As I said, it's coming from a quantitative perspective and moving straight forward to a qualitative data analysis might be sometimes a shock for a beginner. So probably this first study might have missed some key word or process, but I believe for the coming studies, as more I'm working on qualitative study, probably I will start using some of the keywords that you just highlighted.
Okay, thank you very much. Thank you. Very good.